Nice meeting you.
My name is Bugonzi, from the Uganda Nurses and Midwives Association, also from BasiimaCrafts and Team Papa Jasper. We're a community initiative working with health promotion and supporting our communities both in Uganda and in the UK here. I'm a father, I'm a nurse, and I'm an entrepreneur. But the topic today I want to discuss is HIV. I come from a background in Uganda where HIV was most rampant in the 80s, and I remember the entire village being wiped out of HIV/AIDS, and we didn't have any idea what was causing HIV and what it was by then. But today we are lucky, the technology has improved, science has improved, and we've got treatment, we've got prevention measures, and we've got, at least we are leading to a cure HIV. HIV is no longer a threat to many at the moment. However, it's not an excuse that people should be ignorant about it. So as a nurse, we know how HIV is transmitted and how it's contracted. We know it's through sexual intercourse and through blood contact, all the fluids which are causing the major cause of HIV. And because of the current improvement in technology and science, people are taking it for granted and they think HIV is no longer a threat. Having said that, we've got some risk population, for example, the LGBT community, which is the most rampant now in the UK and the world. The African people now, Uganda, we've had the statistics are going high, especially the young children or young girls who are looking for benefits from married couples or those people. So it's very important that people know where to find the support and the need to prevent HIV. We are here today, we've got things like testing kits. You can test yourself on the spot, and within 15 minutes you get results, which wasn't here before. But today we know, once you know your status, you help others to prevent them from contracting HIV/AIDS. So test yourself early before you get sexual intercourse. If you get your partner, sexual partner, you get a kit, get 2 of them, sign a mutual agreement together, go take the tests and get the results, and you know your status. You'll be safe and play it safe. We also have this information leaflet here, which is PrEP. PrEP is a form of medicine, or quite a medicine or preventative measure, whereby you use this PrEP before, at least 24-72 hours before you get involved into
The doctors will advise.
Yeah, the doctors advise you when to use this PrEP. So PrEP is one of the key tools to use when to prevent HIV/AIDS. The most common one is the condoms, use of condoms. In most families or in most communities, they say abstain from sex until marriage. But if you cannot abstain, please use a condom. Use a condom, test yourself, and know your status. Use a condom to prevent contracting or passing on that the HIV infection to another partner. Another thing which is very important is the information to be educated about HIV. We all know the youth, the married couples, the gay community, the elderly, the young, anyone is at risk if you're not protected. But in this community and age, we know that education is power and knowledge is power. So, put this information to the public. Go to social media, go to websites, go to your GP, go to the charities like Africa Advocacy Foundation. They've got information at hand. This charity is the community coming to you where you are every day. So whenever you see their flag, whenever you see their logo, please go to them, seek for information. Come to nurses, they'll advise you. Go to health visitors in the community, they'll advise you. So please, get information from the internet, from your doctors, from the charities, and also, most of all, protect yourself by testing yourself and test your partner and use PrEP. And remember, HIV still kills. HIV is silent killer in many communities. Thank you very much.
Thank you so much, Mr. Bugonzi. As he has said, he's the treasurer of the Ugandan Nurses Association based in the UK. They've just had their annual general meeting in Northampton. Yes. Today we've met at Charlie Muga Teenage Cancer Run. Why is it important for you to get involved in this kind of initiative?
As I said at the beginning, I said I'm a father, I'm a parent, I've got young children as well. To see a young boy with a future having a diagnosis of cancer, which is to many people, cancer is like a death sentence. We're talking about HIV, but cancer is at the same level almost as HIV. And a young child, why should they suffer? What are the causes of cancer? We need to know, how do we prevent? Is it genetic? Is it something which is contracted because of lifestyle? Is it something which is out of negligence? So we need this information. Some of us, we don't know what's causing it. But what we know about cancer is that our lifestyle matters a lot. Also, we need to know in our family that if a member in the family had certain cancer, it was diagnosed, and we know what it is. So how do we prevent it? How do we know? Because we are now at risk. You know, at least if a member or your grandparent had cancer, and at least one of you down the line will get that cancer. But you need to know the measures which you take to prevent. If you eat well, exercise, make annual MOT or checks with your doctor, and catch it early, you can be treated. But if you don't get tested and leave it late, it will become terminal. And that's what we are looking for now, the same as HIV. Don't leave it late. Cancer and HIV, take them at the same level. Catch it early, treat it, and kill it. That's what I can say. That's why I'm here today, to raise awareness for both HIV/AIDS and cancer, and support saving lives of so many young ones. Thank you very much.
Thank you so much. I think I should raise this with you. We have been told that among the health sector, there is some HIV stigma. So I know not every person within the health sector, but some still have stigma. What do you have to say to those who still have HIV stigma within the healthcare sector in the UK and in other countries?
Thanks for that question. As I said, I'm a nurse, not just a nurse, I'm a psychiatric nurse. Stigma starts with fear. Stigma starts with people, they fear to be shame. It's about shame as well. Because HIV, when somebody says, well, you've got HIV positive, people think you've been not, what do you call it, which term can I use? You've been not faithful to your partner. You've been playing around. Something like that.
Okay.
So what I would say, stigma is like trauma. Some people, some of us, from my earlier explanation, we come from a country where so many people died. It's traumatic experience, which is causing even mental health. So those things, they lead people to understand that HIV, we didn't have the information before. You touch someone, blood, whatever, sex and all those things. People still fear. And people fear to come out because they think it's a death sentence. As I say, it's a shame as well, because now all this information is here, but people don't get tested, especially men. In fact, I'll raise this one to men. Men, we take it too late to get tested in so many aspects. Men, we don't get tested. Women, they're doing very well. They know when they feel any ailment, they go to their GP, they get tested. Men, we leave it long because we feel we are resilient. Okay? So, why do we leave it long? Why do we have stigma? HIV is not an easy disease. Okay? We know it kills. It kills. It only kills those who are not looking after themselves. What does it seek support? So the stigma can be stopped in the health sector because we need to educate ourselves as nurses, as doctors, because people take us to know as people who understand the processes why the HIV is contracted. But when I get it myself, it will be like shame, because how did I miss that information which I'm teaching to others? So it's good to raise this information, put these flyers and posters in hospitals, and people get aware, because sometimes we neglect ourselves while supporting others, and we miss all that important information. Yeah.
Thank you so much. Thank you so much. Thank you so much. Thank you so much. Thank you so much.
I don't know how it was.